Welcome back to the Invisible Science of Smiles. Today we're going to talk about a very hot topic. When dentistry turned into shopping. So they see a feeling as if they were buying a handbag, a crown like if they're buying some shoes. So why is it different? Why does it cost more here? Can you just do the cheapest option? But I want it to be excellent and that it lasts forever. It is just the era that we are on. Because the way we think about our oral health and smiles has changed dramatically across history, and especially across the last couple of decades. Is dentistry healthcare or is it retail? Because depending on how you answer that question, you will interpret every recommendation from your doctor in a different way. The label on the procedure tells you almost nothing about the condition underneath. A feeling. A feeling can be a small repair in a strong, or it can be the last attempt to hold together a tooth that has been compromised and it's been breaking down over the years. So let's go through different eras and see what has happened in dentistry. So the first era, I like to call it the survival dentist. So in the beginning, dentistry was not about beauty, it wasn't about confidence or even long-term planning. Dentistry was basically about survival. People usually went to the dentist because they were in pain, they had swelling, they had infections, they wanted relief, and they wanted something done because their life could be at risk. These infections used to put people at risk of dying. So they wanted it to stop. People were not comparing clinic. They were not asking about brands, how much is it going to cost here, or trying to find the cheapest option. No, they were suffering and they needed help. And in that era, people understood something that slowly we have forgot. Healthcare was difficult and outcomes were not always the way we wanted. They were not predictable. And the body did not always cooperate. And treatment was about doing the best possible in a difficult situation. The second era, I call it the repair dentistry. So dentistry started evolving. We moved into an era where we started repairing disease. Fillings started to become more common. We started having the options of crowns. Dentures appeared. Root canals now allow us to treat a tooth that otherwise will have to be removed in the past. We have many different treatments for any disease that we have in the oral cavity too. So dentistry was no longer only about stopping pain. Now dentistry is more about restoring the function and trying to preserve the teeth as much as possible and managing the damage.